enthusiast, Dr. Batson has hands-on experience in weight and fitness training as well as nutrition. In addition, he is qualified and is certified in blood. I hope I get this right. Microscopics, U.S. trained, and he has attended numerous product lectures and health seminars hosted by our own product suppliers from international organizations. Dr. Batson possesses a plethora of knowledge when it comes to their line of natural and organic health and wellness products, as well as their application to specific health disorders and chronic diseases. Good afternoon, Dr. Batson.
Hi, good afternoon. How are you doing?
I am fine, and welcome to Freedom 106.5 FM. Where do we begin? Could you tell us about Batson and Associates?
Okay, yeah, definitely. Well, apart from what it is you read there, in addition to that, my qualification, I hold a bachelor's in holistic health science, a master's in health science, and I completed a PhD in natural and integrative medicine with a concentration in clinical nutrition. So clinical nutrition is basically nutrition for disease. Batson and Associates is our organization. We have been around for the past 13 years, and our area of specialization, as I said, clinical nutrition. And the objective of integrative medicine is primarily not necessarily addressing symptomology only, but really looking at the root cause of what may cause disease. So you have over 55,000 named diseases, right? So let's say we look at basic ones that we may be familiar with. So we look at diabetes, for example. You have different types of diabetes. You actually have 5 types of diabetes. A lot of people are not aware of that. They're quite familiar with the first 3, which would be type 1 or insulin-dependent diabetes. They would be familiar with 2, which is diabetes mellitus. And they're also familiar with 3, which is gestational diabetes. But you also have 4, which is early onset diabetes, and 5, which is when you start to have what is known as glucose intolerance. The thing is, diabetes is fundamentally the excess levels of glucose that remain in the bloodstream, because under normal circumstances, a healthy individual or a healthy human being, you do not carry or glucose, is never stored in your bloodstream for any lengthy period of time. Glucose is supposed to be stored in cells, and your body is going to basically utilize the glucose when it's ready to use it. And there's a whole biochemical aspect where insulin gets involved and that type of thing. But the fundamental issue is that you have excessive levels of glucose that remain in the bloodstream over an extended period of time. Now, the thing is, diabetes is the symptomology, which is excessive levels of glucose in the bloodstream. But the causes of diabetes could be numerous. So I could give you an example. An individual who, for example, has serious gastrointestinal problems. So you have problems assimilating food. Your food is not digested properly. You may have issues associated with what is known as leaky gut. So leaky gut is a situation where your large intestines is primarily a semi-permeable membrane. So it's like a strainer. So if you have leaky gut, it means the holes in the semi-permeable membrane or the strainer is larger than it's supposed to. So a simple analogy, let's say you make lime juice and you throw it in a strainer that has holes. Obviously, you wouldn't only get the juice alone, which is what you want. You're going to get like lime seed and pulp and whatever the case may be. So similarly, if you have a leaky gut situation, it means that pathogens could now leave the intestines and go into the bloodstream, because the most amount of absorption takes place via the large intestine, well, small and large intestines. So as a result of that now, you have pathogens in the bloodstream that could cause a number of things. So when we're talking about pathogens, we're speaking about bacteria, virus, fungus, protozoa, or worms. So any one of those could actually get into the bloodstream. So you have an organism that is not supposed to be in your bloodstream that is now there. And all living organisms do 2 things. They eat and they excrete. So it means these organisms basically excreting and taking your nutrients and that kind of thing. So a situation like that could actually contribute to someone becoming diabetic. Let me give you a next example. You could have someone, female, who is perimenopause. So she has reached a stage in her life where she's no longer seeing her menstrual cycle. As a result of that, we know there are changes hormonally, but there are also changes in the endocrine system. So the endocrine system is the system that controls your glands. So you have your thyroid, parathyroid, pituitary, and glands produce hormones. Now the thing is, because of that change in this female's life, because of the hormonal imbalances, including hormonal balances with insulin, it can be a bit more easier, or it can shift to the situation where you can actually now become pre-diabetic or diabetic as a result. So fundamentally, what I'm trying to explain is that when you look at disease, your objective, disease is always a symptomology of a greater problem. How do you now address or identify what the greater problem is, and then address that to bring about a correction of the symptomology?
Dr. Batson, what would you say overall, having many, many years in the medical business and seeing many people, what would you say is the overall core, what I would say, with issue when it comes to health in Trinidad and Tobago? Where does it stem from? What is it?
Well, like with everything else, it stems from your lifestyle. You know? You see, the thing is, as I always tell persons, I'm not in the politics of medicine. I don't argue with anyone. The thing is, your lifestyle will always be fundamentally associated with lifestyle diseases. And I mean, that's common sense. So a lot of persons like to go on the crutch that I come from a family that is diabetic. So I come from a diabetic family, or I come from a family that is hypertensive or has cardiovascular disease, or whatever the case may be. And even though you may have a genetic predisposition to particular type diseases, that predisposition most of the time is very small. So, you know, there's a saying we have, genetic would load the gun, but your lifestyle is going to pull the trigger. So when you look at Trinidad and Tobago, I mean, diabetes is fundamentally the biggest issue that we have here. We, per capita, in the world, we are one of the highest. In the region, Caribbean and Latin America, we also one of the highest. We also have a serious issue with adolescent diabetes. Again, we are one of the highest in the world. We also have a serious issue with adolescent obesity and obesity in general. We also, within the past few years, we have seen a significant increase in cancer, different types of cancer, fundamentally breast cancer among women, prostate cancer among men, colorectal, pancreatic cancer as well. And as I said, it primarily has a lot to do with our lifestyle. Now, one of the things that a lot of people do not like to hear, we are a nation that cannot entertain without alcohol. So everything that we do, everything that we have, we need to have some sort of alcohol involved. You know, so we have a holiday, we drink. You get married, they drink. You have a christening, they drink. People die, they drink. So because of that particular lifestyle, and then we consume a lot of processed food now, in the Caribbean, we don't really understand portions. So most of the time, our meals are very high carbohydrate meals. So you find because of those different aspects of our lifestyle, and then we have a sedentary aspect, not much of us really exercise and that type of thing. That primarily contributes to those two main issues, or those 3 or 4 main issues that primarily affect us, which is diabetes, obesity, and cancer.
Now, you talk about our local lifestyle, which pretty much stems into our culture, but I see you are quite versed in other cultures as well, dealing with Ayurvedic, Chinese, natural, nutritional medicine. Could you tell us more about that?
Yeah, so the thing is, when you look at medicine, there are different types of medicine, and it's quite unfortunate that a lot of people do not understand that. So when you're looking at Western medicine, which is also referred to as allopathic medicine, has basically 3 functions that they would normally offer. So you could either have surgery done, you could either be given chemotherapy or radiation, or a prescription would be written for specific type medications, whether it's diabetes, whatever the case may be. When you start to look at the East, so when you're looking at places like India, China, Malaysia, that type of thing, their medicine, India is primarily Ayurvedic medicine. And the foundation of Ayurvedic medicine is primarily energy-based medicine, in the sense that when you look at the human body, you have the physical body. Now, the physical body is not the only body that we have. We actually have 4 other bodies, and those bodies are actually higher than the physical body. The physical body is the last body. So your first body is really a spiritual body. The second body is what is referred to as your supramental or your subconscious mind. Then you have your mental body, which is your conscious mind. And then you have your vital body, which is your energy body. And the last body is your physical body. What Ayurvedic medicine and Chinese medicine, homeopathic medicine really encompass is actually addressing those upper bodies so that the last body, which is the physical body, would be healthy. We call it, it's called something known as downward causation, where, as I said, those upper bodies can now affect the physical body. So a simple analogy would be someone who is stressed. So let's say you have stress. What type of stress? You might be emotionally distraught because of a relationship, divorce, the death of a family, or someone like that. Now, that is primarily aspects associated with the subconscious mind, the conscious mind, and some aspect of the energy body. The thing is, because that is out of balance, you can now have a physical or a physiological function being disrupted. So a perfect example would be the stress hormone, which is cortisol. So a lot of people, when you are stressed, even though that is a mental or a psychological issue, it now causes a chemical reaction in the body, which can now cause a physical response, which could now cause obesity, inflammatory response. The topic that I decided to speak about today is arthritis. Now, you have many different types of arthritis. So you have rheumatoid arthritis, which is one of the most common. You have osteoarthritis. Rheumatoid arthritis has a lot to do with inflammation or inflammatory response in the musculoskeletal system. So when we're talking about the musculoskeletal system, we're looking at bones, tendons, ligaments, that type of thing. So if someone is diagnosed with rheumatoid arthritis, it means that the inflammatory response or inflammation in the bones or the musculoskeletal system is much higher than it's supposed to. Now, a lot of people would be familiar with autoimmune conditions. So, for example, lupus is an autoimmune condition. Rheumatoid arthritis is an autoimmune condition. Interestingly, diabetes is also an autoimmune condition. So what does that mean? You would be told that it means that your immune system is attacking the body. Now, that is not entirely the truth. Inflammatory response is a normal, healthy function of the body. So, for example, when you get, let's say you get a lash or you're in an accident, you fall, you hit your head or something like that, immediately swelling is going to take place. Now, swelling is one of the body's aspect of inflammatory response. So all the cytokines and these different white blood cells would rush to the area and try and cordon off or block off that so that the inflammatory response or the inflammation does not spread. So that's a normal function. But when it reaches the point where you now have chronic inflammation in the body, it means that this inflammatory response has created an environment that is now conducive to disease. And that is something that a lot of persons don't understand. So, in other words, if you have arthritis, rheumatoid arthritis especially, the objective in dealing with that is to reduce the inflammation. How do you do that? So Western medicine would normally recommend a few steroids. So they'll give you something called prednisolone, which is the main corticosteroid that is normally used. The problem with that is that it primarily suppresses inflammation and not remove the inflammation from the body. A simple thing that a lot of persons could do to correct inflammatory response is just increase the amount of water that they drink. Now, a lot of persons not aware that when it comes to water or hydration, that is one of the main needs of the body or one of the main requirements of the body. So oxygen is the first major requirement that the body needs. You cannot go without oxygen for any extended period of time. You will die, you'll suffocate, you can't breathe. Now, after that, people would think food, but it's actually water. Because your body is 70% water. The rule for drinking water is your body weight divided by 2 in ounces. So you'll hear a lot of people say you're supposed to drink 8 glasses of water, but that's not true. Because if we're looking at someone who weighs 180 pounds, half of 180 is 90. That we're looking at 90 ounces of water. If you do the maths, that looks like about anywhere between maybe 2.5, 3 liters of water for that individual. But someone who weighs 280 pounds or 300 pounds, their water requirement is going to be additional. Because you're using a formula, and the formula is your body weight divided by 2 in ounces. But the lack of hydration can cause a tremendous amount of issues in the body.
Wow, Dr. Jason Batson, the Managing Director of Batson and Associates Limited. He has over 12 years of experience in the health and wellness industry. If you would like to pose your questions to him, do make note of our numbers 627-3223, 627-3223, or 625-2257, 625-2257. Our WhatsApp is 306-1065, 306 1065. Dr. Batson, are you saying that arthritis is in general a symptom or a pre-symptom of a disease to come?
Well, not necessarily a disease to come, but it's an existing, it is a symptomology of a greater problem. So, okay, so if we have 100 dominoes and we push down the first domino, right? Everybody fall. In order to pick up that whole situation, which domino do you pick up first? The first domino that fell or the last domino? You'd have to pick up.
The first one.
You'll have to pick up the first one, exactly. You can't pick up the last one that fell, right? Because all the other dominoes resting on it. So so I use that analogy to explain. Okay, so let's break down the human body in its basic aspect. So we talk about the different aspects of the body: spiritual, supramental, mental, vital, then physical. So let's look at the body now from the perspective of anatomy and physiology. So you have 11 organ systems in your body. So you have your gastrointestinal system, your musculoskeletal system, your integumentary system, which is primarily your skin, your pores, dermis, epidermis, that type of thing. Then you have sexually reproductive system. So between male and female, 10 of the systems are the same. The only one that differ fundamentally is the sexual reproductive system among men and women, male and female, right? The most important organ system in the body is your gastrointestinal system. How so? So your gastrointestinal system would encompass, primarily starts from your mouth, because digestion begins in the mouth, right? Salivary amylase is one of the things that would help to begin in the digestion of food. You have your teeth. The reason why we have teeth is to chew our food, make it smaller, surface area to volume ratio. So when it gets into the esophagus and further goes down the gastrointestinal tract, it is much smaller and it helps the body in terms of digestion. What makes that system so important and fundamental is because it controls two things in the body. It controls the assimilation or the digestion of food, and it also controls the elimination of waste. So the thing is, if that is not functioning properly, it creates an environment that is conducive to disease. One of the things I said at the genesis of the program is that I spoke about leaky gut. And leaky gut is something, just recently, like maybe about 3 years ago, Harvard University did an extensive study on gastrointestinal health. And one of the things that they were able to determine is that there are a lot of persons out there who have leaky gut syndrome. And as I said, you have pathogens that live in your intestines. The thing is, these pathogens make up or comprise 70% of your immune system. So in other words, if you have a poor gastrointestinal system, it means you have a poor immune system. Now, that is a big thing because we know now a lot of people are more aware of health and certain things because of COVID-19. So it means that if your immune system is compromised, you're in serious problem, and it's very easy for you to become ill. So rheumatoid arthritis and all autoimmune conditions primarily stem from an unhealthy gastrointestinal system. So someone listening might say, well, how do I know my gastrointestinal system is unhealthy? There's a number of ways to highlight that. One, if you have a lot of gas, so some people and some people make joke about that. You know, you may be belching a lot or you pass a lot of gas. You might be always bloated. That's a sign of serious gastrointestinal issues. You might be constipated. Now, there are some people who will get bowel movement every day. And you might say, well, okay, I'm not constipated. I get bowel movement every day. But then what you have to take into consideration is the amount of bowel movement that you're getting based on what you eat. Because if you're having 3, 4, 5, 6 meals a day in some cases, how is it that you're having one bowel movement? Some people have none. Some people will go a week or days without having a bowel movement. That again is an early indication of serious gastrointestinal health. So the thing is, rheumatoid arthritis is actually parasite in your bones. You know? How did the parasite get into your bones? They got into the bones because they left the intestines, got into your bloodstream, and anything that gets into your bloodstream goes into all aspects of the body. We could use our next example quickly before I give the office locations and the clinic locations rather than the telephone numbers. Look at women now with hormonal imbalance. So these women would have polycystic ovarian syndrome. They would have fibroids, infertility, blocked fallopian tubes. The list is long. Where did that problem come from? So if a female has hormonal imbalance, if she has fibroids, polycystic ovaries, she has a problem with estrogen. Estrogen is produced where or by what? Estrogen is primarily produced by the endocrine system. So the thing is, the endocrine system is not functioning properly. And as a result of that now, you have a hormonal imbalance situation. And as a result of the hormonal imbalance, you now have either polycystic ovaries, fibroids, ovarian cysts, endometriosis, you name it, adenomyosis. The list is long. The point is, the original issue came from the gastrointestinal system. And that is what you have to fix. And that is the difference with integrative medicine as opposed to Western medicine. It's not necessarily a plaster fast soil. And that's why I said in the beginning that lifestyle is always fundamental. I don't know. I don't know. In fact, I don't even know your name. My apologies. But
Samantha.
Samantha. Okay, Samantha. The thing is, women in general have an issue with drinking water. Some of them, for a number of reasons. Some people might think the reason valid because a lot of women, you wouldn't have access to washrooms. You can't be going and urinating all over the place. So because of that, you'll say, well, okay, I try and limit the amount of water I may drink during the day. But the thing is, though, the thing with that is eventually it's going to cause a lot of problems. Because as I said, if your body is 70% water and you're not hydrating properly, that is going to be a contributing factor to a number of different diseases. The hospital full up with a lot of people because they don't drink water. I don't know if you personally have ever heard persons talk about water. There are people who they don't drink water. And a lot of them in their mind, they think, well, okay, I'm supposed to drink 8 glasses, which we just discussed is actually incorrect if you're looking at different body weight and body, even the activities that you do. If you're someone who exercises a lot, you run, you walk, you sweat a lot, it means you need to replenish the water or rehydrate based on what you have lost. So a lot of the times, if you're not doing that, it creates an environment that is conducive to disease. I'll give a quick analogy. If you look at persons, for example, okay, so you have a yard, you forgot a bucket, there's some water inside of there, some stagnant water. So you're gonna start to breed what? Mosquitoes, right? So you're gonna spray mosquito Monday, Tuesday, Wednesday, Thursday. So every time you're killing these mosquitoes, whatever you're using to get rid of them. The thing is, next week, you're gonna have more mosquitoes, right? The objective or the issue, the mosquito, is the symptomology. The root cause is the stagnant water. So until you get rid of that environment that is conducive or causing the problem, you will always have the symptomology.
Could we go back again to the question or the issue about water, especially for myself? There have been so many options when it comes to water. So there's drink the 8 glasses of water. You were mentioning the formula with your weight.
Right.
Then I was also reading that, maybe you should only drink if you feel thirsty.
Really?
And that other drinks that you are consuming, maybe your coffee and tea,
right,
also count to hydration and not just pure water.
Okay, cool. All right. So based on what you just said, so we're going common sense made before book. So let's break it down. If it is we're saying that you only drink water when you're thirsty, thirst is actually a message, an emergency response that the body gives. So if you're thirsty 3 o'clock, you were thirsty actually since 2:30 because that message takes 30 minutes to reach. So that option there, that making no sense at all. Because it means you would have, your body has been in emergency or reached the stage where it is in an emergency and it now has to signal to you, listen to me, I am thirsty, I need to drink water. Anytime you're waiting until you're thirsty to drink water, you're sick already. So that definitely out of the equation. So based on, because it's like surgery. If you have to perform surgery on a man that is 350 pounds, as opposed to a man that is 100 pounds, the anesthetic that the anesthesiologist is going to have to give is going to be at different levels of anesthetic, to put that person to sleep. There's a formula to work it out based on the person's weight. So the same applies with water. And then you can't count other drinks. So you definitely can't check coffee. You definitely can't check juice. You definitely can't even check soft drink. Because again, that don't make any sense. The 2 organs in the body that primarily is disadvantaged as a result of dehydration is fundamentally your kidneys and your liver. You have 7 channels of elimination in the body: kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. All of those organs depend on water. Your lymphatic system does not have a pump. Your circulatory system has a pump, which is your heart. Your lymphatic system functions with gravity and water. So when you drink coffee or you drink any other drink that is not water, your lymphatic system cannot identify it, and it can do nothing with that.
Thank you for that info, Dr. Batson.
Yeah.
Dr. Batson, I see that you have 4 different locations, Shogunas being the head office,
Yes.
Davie, St. James, and Tobago, but you're also planning to open a diabetic and eye clinic in the future.
Yeah, well, the diabetic center, which we have primarily a diabetic center of sorts already, but we'll just be extending that to all of the locations. So we are Money Talks in Montrose, Shogunas. The telephone number for that office is 222-8261. We also have Davie. Davie is the corner of Ramsey-Mooch Trace and the SS Erin Main Road in Davie. That telephone number for Davie is 223-7515. St. James is Red Edge Mall on the Western Main Road in St. James. I cannot remember that telephone number. So if you call the 222-8261, which is head office, they could always give you that. And then Tobago is the Triangle Building in Scarborough, Tobago. And the same applies. You can call 222-8261. Also, our social media, we are Batson and Associates Limited on Facebook. On Instagram, we are Batson and Associates TT. And on YouTube, we are Batson and Associates Trinidad. So you could always look there and you'll see all the information regarding the services and the different products and whatnot that we offer. And you also have access to all the lives that I do, because I'm actually live on Facebook, Instagram, and YouTube simultaneously while we're having this discussion.
And I also see, and you did mention about your products, that they are your own line of natural supplements. Could you tell us about that?
Okay, well, that's part of the products that we carry. So there's a line that I have, which is called Equilibrium, which of course means balance. So there's a product that we have something called Santulan, which is a 7-channel detox. Santulan in Hindi means balance. And what that does, it cleans and detoxifies kidney, colon, bloodstream, liver, lymphatic system, skin, and your lungs. That's one of the most popular ones we have, because a lot of people always want a detox, but I think a lot of people don't understand or don't know what to use, because there's a significant difference between a detox and a purge. So I'm not an advocate of purging. Detoxing is completely different. So that's one. We also carry a product called Women's Formula. That's quite popular too, because that helps with things like polycystic ovaries, ovarian cysts, endometriosis. So it actually helps to balance the endocrine system and then help with balancing one's hormones. There's a next one we carry. So that line is a bit extensive. We have Nerve Restore. That's primarily central nervous system. So it's an adaptogen. So it deals primarily with people who have problems with insomnia. So if you have problems sleeping, if you have things like anxiety, depression, it actually helps in rejuvenating one's neuromuscular and neurological system. Because one of the main purposes of sleep is to really rejuvenate the neuromuscular or the central nervous system. People who have issues sleeping, most of the time they actually have a liver problem and they're not aware of it. Simply because your liver converts protein to amino acids to protein. And then your body needs amino acids to actually make neurotransmitters. So in order for you to have proper sleep, you need to have things like epinephrine, neoepinephrine, serotonin, melatonin, and those type of things. So people who have issues with sleep, even depression, anxiety, women, especially if they're going through PMS, postmenopausal syndrome, that's like one of the worst things women could go through, because of those hormonal imbalance in the body, they tend to mentally have a lot of issues. Women who have done things like hysterectomies as well. Hysterectomy is the surgical removal of your uterus. You would usually have a total hysterectomy where they will remove the uterus and the ovaries, or you have a partial hysterectomy where they just remove the uterus. In both instances, you find women could go into menopause immediately and they have things like insomnia, anxiety, depression, those type of things. So some of those products would actually be able to deal with that. But as I said, once you have access to our social media, or you want more information, you can always call, and any one of the offices will be able to assist you as regards to those.
Dr. Jason Batson, the Managing Director of Batson and Associates Limited, with over 12 years of experience in the health and wellness industry, is here with us at Freedom 106.5 FM. You can pose your question to him by calling our hotline at 627-3223. 627-3223 or 625-2257, 625-2257. You can also send a WhatsApp message to 306-1065, 306-1065. Now, Dr. Batson, what would be your system or method if I were to come to you with an illness?
Okay, good question. So one of the things that we do is something known as blood microscopy. So blood is the most tested serum in medicine, and there's a reason for that. Blood basically carries messages. So, for example, if you're doing, let's say you want to do something called a PSA. So a PSA is an acronym for prosthetic specific antigen. So a man wants to determine the health of his prostate, he would do a PSA, and you would have a range anyway between 0 to 4. If, for example, you have a problem with your thyroid, or they suspect you have a thyroid problem, they're going to look at something known as your T3, your T4, and they're going to also look at something known as your TSH, which is your thyroid stimulating hormone. Good. So at Batson & Associates, we do live nutritional blood cell analysis, which is a different type of blood analysis in the sense that it gives us the advantage. So what we do capillary blood, which is blood from your fingers, and we put it under a high-powered microscope and we magnify it about 4,000 times. Now, the thing is, blood is supposed to look a particular way. It is supposed to behave a particular way. It is supposed to be circulated in the body in a particular way. So once we put it under the slide and we look on the microscope, we'll be able to see certain things. I'll give you a quick example. There's something known as erythrocyte aggregation. So erythrocytes are red blood cells. Aggregate comes from the word to stick together. So if your blood cells are sticking together, you have an issue. Now, that could give you a number of issues. It could give you poor circulation. It could also cause problems with your central nervous system, because if you're not getting proper blood being circulated, remember the main purpose of blood is to transport oxygen and nutrients to cells. Cells give you tissues, tissues give you organs, organs give you organ systems, and organ systems give you the body. So it means that we're actually able to look at the body from a cellular level, and it gives us the advantage to look at a number of things. I can see the condition of your kidney, the condition of your liver, if you have any poor circulation issue. There's also a test we do with the blood known as dry blood analysis. Now, there's something known as biological terrain. So when you're looking at biology or terrain in agriculture, so let's say we're looking at terrain in the desert, you can't plant carrots in a desert. You can't plant callaloo bush there because the terrain is not conducive to that particular type of agriculture flourishing there. In a desert, you'll find things like cacti and those type of things because they actually able to survive or flourish in that environment. When we look at the blood from the dry blood analysis aspect, it gives us the biological terrain. So we could actually see if you have issues with your bones, because there's going to be an indication where we see minerals. So people who have a lot of acid problems, for example, you have problems with your bones because your bones are comprised of calcium, magnesium, and phosphorus in the form of calcium phosphate. If you have an acidic situation in the body, your thyroid is the organ that signals to the body how much calcium should leave your bones to go into your bloodstream, because your bones are the warehouses for calcium. So it means in a situation like that, if you have excess acid, you will consistently have calcium leaving your bones. So an individual like that could end up with things like osteoporosis. So we'll be able to see early signs of osteoporosis. If you have rheumatoid situations, we will be able to see that. High levels of inflammatory situations. So if I'm looking at someone, even if you don't even tell me you have lupus or autoimmune condition, we would be able to determine it from that. There's a next test we do called a MRA scan. MRA is an acronym for magnetic resonance analysis. One of the most commonly used magnetic resonance technology is magnetic resonance imaging, which are MRIs. So the technology is similar, but the analysis aspect gives you a reading based on, so we actually were able to see, for example, something known as your brain tissue blood supply. So the amount of blood going to your brain. So there are some people who experience a lot of headaches, and then the doctors tell you have migraine headaches or cluster headaches. You might be diagnosed with something known as vertigo, which is where you have a situation where you have dizziness and you feel as if, you get up and your room is spinning and that type of thing. So once that test is done, we'll be able to determine how much blood you actually get into your brain. And those are primarily some of the tools that we use. And then we'll actually be able to make the general recommendations based on the root cause of those particular issues. If it is I determine that I need more information, well, then I would send you to do an MRI, a CT scan, whatever the case may be. So, but
those initial tests that you discussed will be done at Batson and Associates.
Correct.
Dr. Batson, we have a WhatsApp message from someone in our audience, our Freedom audience. They're asking, good afternoon, Dr. Batson, can you touch on carpal tunnel syndrome, please? What can be used and if surgery is necessary?
Okay, that's a good question. So carpal tunnel syndrome is a situation where persons end up with a lot of issues, pain in the hands. So you usually find people who would have been secretaries, so you do a lot of typing and that type of thing. Because of your hand being in that position for extended periods of time, you would get some inflammatory response or inflammation in that area. As regards to surgery, I mean, my philosophy is this. Surgery should only be done in the case of emergency. We have a culture where they like to cut you for everything. And a lot of people disagree with me, but I have an issue with that. Because once you do surgery, the body is never the same. So in a situation like that, and we have helped numerous persons in that area, it means that the inflammatory response is high in the musculoskeletal system, but concentrated in the hands, in the arms, and that type of thing. So what you need to do is improve the circulation. And in improving the circulation, you'll now improve the nerves. No, you'll improve the nerves, yes, and then you find that situation would be less painful. In some cases, the pain would go away completely. So that's something that we could actually correct in that particular situation.
I'm wondering, I know someone who may have experienced carpal tunnel syndrome at one point in their life. The same thing you're saying, they had a job where their wrists were in a particular position. That would have went away, and then they may have got symptoms in other areas of their bodies, like different joints became inflamed. Is it connected?
Yes, definitely it is. Because you see, the thing is, the inflammatory response, as I was saying, that's the base cause of all diseases. So it means if it is you have inflammation in the musculoskeletal system, you're going to be diagnosed with arthritis. If you have inflammation in your arteries, you're going to be told that you have blocked arteries. So if you go and you do the first thing they might do is an echocardiogram, and based on the echocardiogram, the cardiologist might say, listen, this is pointing to some blocked arteries, so we suggest you do something known as an angiogram. And then when they do the angiogram is going to basically show the percentage blockage in the arteries. The point I'm making, that blockage in the arteries is evidence of inflammation or inflammatory response in the arteries. So just to answer your question, yes, but in its totality, when you look at disease on the whole, regardless of the disease that you're referring to, inflammatory response is always a contributing factor. Always.
Dr. Jason Batson, he is the managing director of Batson and Associates Limited, with over 12 years of experience in the health and wellness industry. And he is here with us at Freedom 106.5 FM, and he's going to be here for a number of Thursdays. Dr. Batson, how many Thursdays do you think you'll be hanging out with us?
Well, as long as you all permit me. only for the decide to put more, well, then I have no choice in the matter. But
maybe forever. I do see here that you would like to open a diabetic and eye clinic.
Right.
Is it that you see many of these ailments in Trinidad and Tobago? Is it a growing number of people experiencing this?
Yeah, definitely. The thing is, once you're a diabetic, and it's not as if this center doesn't exist, it's just we're doing some work currently to upgrade it in terms of the amount of services that we offer. But once you're dealing with diabetes, the issue with that, and diabetes is very close to my heart because, one of my family members who was very close to me when I was younger, which is my great-grandmother, which is my mother's mother. She had raised me at a certain time in my life, but I was always aware, even though I was young and I couldn't understand, I was aware that she was sick. And she had what they would call a sore foot. Now, a sore foot is really when you have a diabetic ulcer. And a diabetic ulcer would normally, her own was very close to the ankles there, and it was pretty large. It could have been like maybe about 2 inches in diameter. It was really bad, and it never healed. So I would always see it as a child and always wonder, what is that? And they would say that your grandmother has diabetes. And, the thing with diabetics, they really suffer, unnecessarily so. Because once you have high levels of glucose in your bloodstream, it compromises your circulation. And once you're not getting proper blood circulation, which is why diabetics end up lose toes, and they end up losing their limbs, they lose their feet. They are most prone to blindness. There's something known as diabetic retinopathy, or what is known as detached retina, where the retina becomes detached, and there's a major aspect associated with eyesight. And most diabetics tend to go blind as adults. And I find that's a hard thing. You're born in this world seeing, you know what color is, you know what yellow, orange, blue is, and then at a certain point in your life, you can't see anything. I find that's a hard pill to swallow. But as I said, you know, it fundamentally comes down to understanding the human body, understanding anatomy and physiology, and most importantly, understanding how your diet and your lifestyle affects you. And that people who know me and know me well, they say I buff. No, I don't buff, but I am just plain talk bad manners. I don't have time for foolishness. If it is, you want a doctor to come, mama guy, and tell you eat where you want and you're going to be healthy, then go buy somebody else. Don't waste my time. But you cannot come to me, and I'm seeing, based on the questions that I asked and the forms that you fill out, that you're eating foolishness, you're eating rubbish, your lifestyle ain't really making much sense, but you come to get a plaster for a story. It doesn't work like that. It doesn't work. It doesn't. When you look at, like I was doing some research this morning, where they talk about blue zones. Blue zones, there are 5 blue zones in the world, if memory serves me right. And blue zones are where people live to be 100 and over. One of those areas is a place in Japan. Now, if you know Japanese people, they smoke more than most people in the world. They smoke a lot. But their levels or their indication of lung cancer is much lower than a lot of other parts of the world. And the reason for that is that their diet, they consume a lot of marine phytoplankton. So they consume a lot of foods from the sea, so a lot of sea moss, or what is known as Irish moss. They use something called fucoidan, which is a particular type of seaweed that is noted for its properties as being anti-carcinogenic. So the point is, based on those people's lifestyle, they were able to live a certain number of years. When you look at life expectancy in Trinidad, and in the US and that kind of thing, it's much lower. But what do we eat? What do we eat? And the thing is, there are a lot of people who get upset, and I don't really care. But you can't be eating foolishness and expect to be healthy. Rubbish in is rubbish out, you know. And the problem is you cannot be using a lot of sugar. We have children. I see children 12 and 13 years. You're obese. You're obese. Now, people might think that might be impersonal and hard as a child. No, because we have children now that are dying from strokes. The World Health Organization has said that this generation is the first generation in human history that parents will bury their children. And we've seen it. You have young girls, 12 and 10 years, that have polycystic ovaries, fibroids. These girls can't even go to school because when their period comes, they have to be home. What is wrong with you? How did that come about? How is it that my mother didn't have that, my great-grandmother, my grandmother didn't have that? What were they eating that we eating now? If you understand what I'm saying, and we need to move away from this whole, well, that's what to eat and are busy. Okay, good. And there are some people who tell you, well, something had to kill you. Okay, good. So if that is your mentality, when you're sick and you're taking, make sure everything good with you and don't call the ambulance. Stop wasting big people time. Now, again, some people might find that harsh, but I mean, you don't be doing this type of work for 12 years and, be somebody who tolerates nonsense. I really don't have time. I really don't have time. And until we come to that realization, we're going to continue to have issues. Do you know that Trinidad and Tobago has one of the lowest fertility rates in the world?
No, I did not.
Yeah, we do. There are a lot of young men walking around here who cannot, not trying to be rude or anyway, they cannot help in any production of anything because the motility of the sperm is non-existent. Why is that? You can be 20 years and you have a motility of somebody who is 80 or 90. What are you doing? The same with a female. You have problems. You're not able to produce. You may have blocked fallopian tubes. We have higher levels of ectopic pregnancy. Ectopic pregnancy is when it's actually stuck in the fallopian tube, and the doctors, as emergency surgery, they have to rush you. If you don't if the doctors don't get to you in time, you will die. So we have more sick people. We have a situation that we need to correct. How did we get here? By eating salad and walking around the savannah? No, we're doing something wrong. So we just need to, really man up and decide, well, listen to me. Are we going to do some exercise? Are we going to eat better? Are we going to drink more water? Have vegetables, whatever the case may be, and understand what it is to be healthy and stop fooling ourselves. So.
Thank you very much, Dr. Batson. As we wind up here, he's getting very, very passionate.
Yeah, I just behave a little terrible. So very quickly, let me tell you those telephone numbers. You can give us a call on 223-7515, as well as 222-8261. And as I said, we quite present on social media, so you could always look there. And then all the lives that I have done for a number of years is there, so you could go there and get a lot of free information. So it's Batson & Associates Limited on Facebook. On Instagram, we are Batson & Associates TT. On YouTube, we are Batson & Associates Trinidad. And those locations, again, first floor Money Talks building in Montrose, Chaguanas. Debe is the corner of Ramsey Mooch Trace and the SS Erin Main Road in Debe. St. James is Red Edge Mall, Western Main Road, St. James. And Tobago is the Triangle building in Scarborough, Tobago. So, Samantha, it was a pleasure being in your company, my dear. And I look forward.
Same here.
Okay, so
a pleasure being in your company and having this intense conversation. I am excited to continue it next week.
Definitely.
You have yourself a great day, Dr. Batson. That was Dr. Jason Batson, the Managing Director of Batson & Associates Limited, with over 12 years of experience in the health and wellness industry. And that was our special health segment featuring Dr. Batson of Batson & Associates. Remember, you can visit them on the first floor, Money Talks building, 182 Southern Main Road, Montrose. That's 182 Southern Main Road, Montrose. You can call them at 222-222-8261. 222-8261. You can WhatsApp them at 314-9975. 9975. That was our wonderful health segment, and it happens every Thursday right here at Freedom 106.5 FM.
The best insight, instant feedback, accountability. The all-new Talk Radio Freedom 106.5.